Hi, I'm Dr. David Ajibade. I want to talk about sickle cell disease, the old approach, what is known as probably the old approach, which is the current approach towards managing sickle cell disease, and what we propose as a new, more practical approach towards managing sickle cell disease. Currently, if a child has sickle cell disease diagnosed, shows the genotype as HBSS, HBSC, HBCC, whatever. The doctor looks at the child, does the examination, takes the tests, and of course the routine medications are initiated. And these include folic acids, sometimes vitamin B, and then of course antimalarials, because antimalarials are prevalent in Nigeria and West Africa. So trying to reduce the burden of malaria would hopefully reduce the stress of the child and reduce the incidence of crises. And then they send the child and their parent on their merry way. And of course, if the child has a crisis, he comes back to the hospital, they're rehydrated, they give them pain relief, they give them antibiotics, maybe admit them in the hospital, they may need a blood transfusion, they give them all that, and then they send them back on their merry way, sometimes with extra antibiotics, sometimes with extra pain relief. And then maybe 2-3 months' time, the child again has a crisis, they bring them back and then wash, rinse, repeat. Same thing over and over again. So our approach that we're trying to really push out, currently we're doing research in Lagos State now, in 3 major hospitals, where our approaches are, well, let's focus on strengthening the immune system. So it's not just enough just to give folic acid and antimalarials and vitamin B complex. The immune system needs to be strengthened so that it can fight all these bugs and these malaria parasites and everything. So our ideal is for them to give routinely vitamin C, vitamin K, vitamin D, and of course, zinc. These have all been shown to improve immune function. Zinc especially is really good to reduce pain crisis. It's also really good to actually address ulcers, especially in the older kids when they have ulcers around their ankles and their feet. So those 3. But at this point, we're starting with the first one, which is vitamin D3. We're doing a study on vitamin D3. Hopefully that will be successful after 6 months. We'll get some good data and then we'll move on to the others. And so in the long run, the data is that we want to use this data to take to the government, the Ministry of Health, and say, hey, listen, this old approach is not working. These kids are still dying, many of them before the age of 5, many of them suffering throughout school and eventually dying in their late teens and early 20s. It's not acceptable. We will show them that vitamin D can improve their health, and so with that, hopefully they'll begin to institute a policy change where doctors and healthcare professionals everywhere will not only be given folic acid, but they'll also be given these 3 things: vitamin B, vitamin C, vitamin D3, and of course zinc. But at least we'll have the data to show to them. So that's the whole idea. And if you want to know and learn more, please contact us. And we'll be more than happy to show you the information that we have. God bless. Take care. Bye.